The ketogenic diet is a medically prescribed diet used for children with seizures that are difficult to treat or in certain genetic conditions. The diet is undertaken with the supervision of an expert ketogenic diet team. It's used in conjunction with other anti-epileptic medications, but importantly does not replace them. The diet is high in fat and very low in carbohydrates. In the absence of enough carbohydrates to make glucose, the body switches to using fats to make ketones, which become the main energy source for the body, including the brain. When the body produces enough ketones, it's referred to as being in ketosis. Maintaining ketosis may help improve seizure control and brain function in some children.
Many children on the ketogenic diet benefit significantly, and some become seizure-free. However, around 25% have little or no response to being on the diet.
The diet is initially trialled for 3 months. If your child improves on the diet, it's usually continued for 2 years. For certain genetic conditions, children may be on the diet longer term.
High-fat foods are required in large amounts on the ketogenic diet to ensure ketosis is achieved. High-fat foods include butter, margarine, a variety of oils, cream, and avocado. These foods will be added to each meal and snack.
Foods that are allowed in moderation include high-protein ones like meat, fish, chicken, and eggs. Foods that are allowed in small amounts include some low-carbohydrate vegetables and fruit. High-carbohydrate foods like breads, cereals, sweets, and sugary drinks are not allowed on the diet. The dietitians will guide you to ensure ketosis and optimal growth are maintained.
As the diet is restrictive, a vitamin and mineral supplement may be required. There are 2 main types of ketogenic diets, the classical ketogenic diet and the modified Atkins diet. The classical ketogenic diet is prescribed using specific ratios of fat compared to protein and carbohydrate. For example, a 4:1 ratio has 4 grams of fat for every 1 gram of protein and carbohydrate combined. All food ingredients will need to be weighed out on kitchen scales to ensure the correct ratio is maintained.
For infants, there are special formulas that can be used to replace infant formula or milk. The classical ketogenic diet is generally used for patients under the age of 2 or for children on tube feeds.
The modified Atkins diet is generally used for patients over the age of 2. On this diet, only a small amount of carbohydrate is allowed per day. Fat will need to be added to meals and snacks.
High-protein foods can be consumed in moderation, similar to a normal diet. This generally allows more freedom for recipe modification and food product substitutes. Patients and their families are taught how to count and identify carbohydrates in food. Both types of ketogenic diets have their challenges, and one is not necessarily better than the other. They require families to be committed and highly motivated. Despite this, sometimes children may refuse to eat the foods. Your dietitian and medical team will determine which diet is more suitable.
For parents considering the diet, I would say go in with an open mind. It is hard work. In the beginning, it's a lot of hard work. There's going to be times where you're just going to look at it and you want to give up, but I would say push through. It took us at least, I'm going to say a good 6 months to get used to everything. But each week we were seeing more and more results, so it was worth the hard work. The hardest thing is being prepared, like meal prepped. You're so used to just packing your bags and getting out for the day, but you really need to be prepared with your meals. It's not easy just to go to the food court to get something, and then measuring out the meals in the beginning when you first start the diet is time consuming. It does your head in sometimes. It definitely gets easier along the way. Within the first week that we started the diet here in the hospital, life came into my son's eyes. A child that has seizures on a daily basis, the first thing that you notice with them is they just look tired all the time. And by day 4 of starting the diet, he got life in his eyes. To me, that was worth it. In knowing that we're doing everything right, we know that we have a decrease of seizures, so he has a better quality of life. We all actually have a better quality of life. If he's doing well, we're doing well.
Children require a blood test before starting the diet to ensure that it is safe to do so. Starting the diet requires close contact with the team and may require a stay in hospital.
Once on the ketogenic diet, your child will require regular medical review every 3 to 6 months in the outpatient clinic. The ketogenic diet team will be available to provide ongoing support. Growth, seizure activity, blood test results, side effects and diet tolerance are medically monitored. You will be taught how to monitor ketones and blood sugar levels at home. And the team will ensure that your child is receiving adequate energy and nutrients for optimum growth. You'll also be given education on how to care for your child when unwell or fasting for an operation or procedure.
Like any medical therapy, the ketogenic diet can have potential side effects. Low blood sugar levels, known as hypoglycemia, can occur and will require medical review. You will be trained to monitor for signs of hypoglycemia and also how to manage these. When your child starts the ketogenic diet, they may feel tired for several weeks. Other side effects when starting the diet include hunger, vomiting, diarrhea, abdominal pain, and constipation. The medical team will advise you on how to manage these symptoms if they occur. Longer-term side effects can include kidney stones, high blood cholesterol and triglyceride levels, poor growth, excessive weight gain, fragile bones, and vitamin and mineral deficiencies. All of these side effects are monitored and medically managed as required.
The ketogenic diet can be very effective therapy for some children and lead to significant improvement in their quality of life. The ketogenic diet is a high-fat, low-carbohydrate diet used to treat seizures that are difficult to control and in certain genetic conditions. It's medically prescribed and requires guidance from a specialist ketogenic diet team to make sure that it's safe and effective. There are challenges and side effects when on the diet, and regular medical monitoring is required throughout the duration of the diet.
The ketogenic diet team will be able to provide education and support if the ketogenic diet is recommended for your child.